myself, Dr. Sharana Basava H, consulting physician working at Sharana Basava Hospital, Gangavati. Today, I'll be talking about lifestyle modification for management of GERD. So, what is GERD? So, GERD is a severe long-term condition where acid and other contents of the stomach flow back up your food pipe. This can cause many symptoms like heartburn, chest pain, sore throat, and others. Without treatment, this persistent acid reflux can injure the food pipe and also lead to other severe conditions. GERD can be managed through PPIs and H2 blockers. Besides these medicines, there are other certain changes one can do, mainly the daily habits to make their lives better. So, what are the lifestyle modification that we can habituate in GERD? The main thing is diet. If you're suffering from GERD, the biggest change you can make is to control what you eat and when you eat. Try eating smaller meals more often, because if you eat too much or if you stop yourself, you can increase the amount of acid reflux that gets produced. You should also try avoiding certain foods, especially oily rich foods, spicy food, coffee, tea, alcohol, and carbonated drinks. The next one is avoid lying down. So mainly do not lie down immediately after eating. At least you should have a gap of 2 to 3 hours between the meal and the sleep. So when you eat around 8 o'clock, you should sleep around at 10 o'clock. So that is the next one. The one more thing is you should avoid exercise after meals. Do not do any heavy exercise right after eating. You can take a walk if you want, but do not indulge in any heavy exercises, okay, or bending down or anything like that. If you bend down, it can cause stomach acid to come up through your food pipe. One more is sleep in inclined position. Try and keep your head at least 6 to 8 inches above the level of your feet when you lie down. You can use an extra pillow or wet pillow, which you can get in any shop. Next one is losing the weight. If you have a lot of belly fat, it can put an extra pressure over your stomach. This can affect the muscles in your stomach and cause acid reflux. So losing your weight can help to reduce the symptoms of GERD. One more is quit smoking. So mainly the cigarette, which contains nicotine, which can affect the muscles of the stomach and weaken them. So it will increase the acid production in the stomach. So avoid smoking. And one more is wear loose fitting clothes. So your clothes should be very loose, so that if you wear a loose cloth, it will put a pressure over the stomach and it will increase the acid reflection. And one more is you should review your counter medicines. If you are taking any medicines for any health issues, check with your doctor if they could causing the symptoms of GERD. Certain medicines like estrogen pills for postmenopausal women or antidepressants are mainly pain muscles in your stomach and food pipe that can cause symptoms. So by including these simple changes in your daily life, you can lessen your discomfort if you are affected by GERD.